Hi, this is Dr. Gibbs in Glen Ellyn, Illinois. Welcome to a webinar on So You Hate Your Dentures. What are the alternatives? Um, First, if you have your teeth, save them. I know people get very frustrated with their teeth, but the many more problems with dentures. And we do another video on dangers of dentures, another video on that discusses the biologic changes when you lose teeth, the problems of bone loss, loss of facial mass, things like that, sunken teeth, cheeks, and particularly why that happens. Lots of choices, all the way to keeping what you have, all the way and mini implants to implant-supported dentures. We'll talk about all the changes. What will determine your choice will certainly be comfort factors, health factors, force factors, bone factors, facial aesthetics, smile aesthetics, your cheeks sinking in, your gum show, lots of factors that will determine your choice. What is an implant? Think of implant as being an artificial root made of pure titanium. The bone actually fuses to the implant, very strong, biocompatible. Success range is in the 98% range. They can either be function by themselves or in conjunction with other implants to completely replace dentures or stabilize them. Again, we'll look at all these choices. Lots of advantages to better speech, better aesthetics, better no plastic on the roof of your mouth, ability to chew, smile, and not have to worry about things falling out. One thing you'll see online is mini implants. I do use mini implants. They aren't always my choice. You can see in the bottom picture there, a mini implant being the one on the bottom right. It's very, very small relative to the other ones. They are not going to be as strong, not going to be as long lasting, but certainly if cost is a consideration, they are a great adjunct for stabilizing dentures. A little bit more successful, in my opinion, would be an implant retained denture. Again, here we put a couple implants in and basically snap that denture into place. It does not flop around. It is one of the less costly approaches there. Far more advantage to stability-wise than a conventional denture. You do still have to reline these, clean them, maintain the little clips there, and you can actually get increased bone resorption in the back area. Again, another consideration. Next up would be an implant-supported denture. The great advantage of this is that the denture is no longer supported by gums. It is supported by the bar. I know that bar looks a little scary, but boy, that denture locks into place. It is comfortable. They can chew virtually anything. This lady was so happy to have that done. Another example of that right here, you can see again, the little diagram shows denture resting on the bar. One thing you will see going online is all on 4 teeth in a day, teeth in an hour. The advantage of this is basically speed and convenience. Disadvantage is if any of those 4 implants fail, think of it as just like being the legs of a chair, legs of a table. The whole thing goes down. In my opinion, at this point in time, spend an extra 3 months, put in another couple implants. You'll get a far more stable type of thing, and what I would oftentimes recommend there would be a fixed implant bridge. Here you can see a diagram of that there. We basically place the implants, sometimes 6, sometimes 8, sometimes fewer, sometimes more, depending on the quality and quantity of the bone. These people can feel the roof of the mouth again. That's bolted in place. The facial muscles do not atrophy. You're chewing with almost just like regular teeth again, for goodness sakes. Far better, more permanent solution. Considerations: does cost more, does take longer to do, but these are beautiful restorations. These bolted in place look just like regular teeth. These people are able to eat basically anything again. I can't tell you how many people come into the office saying, my God, get this plastic out of the roof of my mouth. I can't feel food. I'm tired of things falling out. I'm tired of the goop. This is a solution that virtually ends all of that. Again, put in place, these look like 20-year-old teeth. Beautiful restorations. Sometimes they're made out of porcelain, sometimes they're made out of acrylic, but again, that's going to be quality and quantity of bone and your own particular considerations there. Again, not a diagram to illustrate what's going on there. To be able to do this type of dentistry, sometimes we have to use highly sophisticated computer software. We use CT scans, three-dimensionally image the bone. These are precise procedures. Take a look at these pictures here. We very precisely pre-planned. These procedures are far more comfortable and easy than they were in the past. This type of software and pre-planning we do. I'm too old. These are actually Census Bureau statistics. People are living far older, and that's just not how old this quality of life. Ballpark figure. This is a this is actually an analogy given to me by a patient. You can think of a denture as being a worn-out jalopy. You can think of a implant retained as being a inexpensive car, or implant supported like a nice car, and you start going to the all-on-4 implant supported bridges. It's like buying a luxury car. These are not inexpensive. Certainly life-changing procedures, though. You don't have to go all the way to an implant supported initially. I've had many people start by implant retained denture and work their way up. But yeah, quality of life. The oldest person I put implants in was 92. This is some lady who was frail. She was miserable. She could not chew. She could not talk. She could not smile about things falling out. She'd lost so much bone. She lived 3 weeks shy of 96, and she was so delighted she was able to chew, smile, talk, eat again. And take a look at some of the comments from patients. LiveWithoutDentures.com has far more of these on there. Our experience, again, you have to be well trained to do these type of procedures. And if you're ready for this, let know someone who you know. Let them know about this information. We certainly will give them a complimentary consultation. And again, go over on our website, LiveWithoutDentures.com. Call our office, 630-858-8800. Or if you want additional information, call our toll-free number, 888-368-0273. Look forward to hearing from you. Thanks again for listening. Bye-bye.